Throughout most of the corrective movements you're going to be learning about in this course, you'll hear me frequently refer to something called your ASIS. And that's a part of your pelvis we're going to show you here. The ASIS is essentially this bony ridge right on the top of your pelvis. And if you place your hands right in that area, it's very easy to find. So one more time, just from a different perspective, it's this area here, this bony ridge on the front part of your pelvis. So here we have your lower back, here we have your legs, your belly button's going to be right about in this area. So we're looking for these bony ridges on either side. If you are having problems locating it, you can place your hands on your stomach and walk your hands down until roughly the area of your belt line, and then move your hands out from the center of your body towards the outsides. For you guys, this area will pop up very quickly within just a few inches. For you ladies, you will need to go a little further to the outside, roughly 4 to 5 inches, as your hips are wider than men's. Now, why do we use this landmark so often? Why is this area so important? First of all, it is very easy to find, and I don't want there to be any confusion as to where you are placing your hands. It is also very easy to feel movement in this area compared to anything else nearby, so there will be much less confusion in guessing whether or not there is movement or not. The other major reason I ask you to focus on movement in this area is because any movement in the pelvis automatically creates a change in movement in either the spine or the hips. This is not necessarily the case if I were to ask you to put your hands on your spine or your hips, as these areas are able to move on their own without forcing the other to move. We can use this relationship to track any movement that is happening in the spine or hips just by feeling movement in the pelvis. Now, if you have your hands on this area and you do feel movement, what is actually happening? Knowing more about what movement is happening will help bring your mind to the area and make it much easier to recognize when something is not moving the way it should. If you are feeling the ASIS area tipping forward, which is one of the most common movements you are likely to feel, this movement here, tipping forward away from your body, then our spine here is going to be arching up away from the table. This is going to put more stress on the nerves and the joints in the back of our spine, increasing wear and tear. If you feel the ASIS area rolling to one side, then the spine is going to be either twisting here in the lower back or higher up here in the middle back, both of which increase wear and tear in these areas and often lead to nerve type symptoms such as sciatica. Finally, if you feel the pelvis tip backwards, back towards your head, this motion here, then the spine is going to be flattening, increasing wear and tear on these discs in this area and increasing tension on these nerves. So one more time, if we're in a neutral position, the ASIS area tips forward like that. The spine overarches. If we tip to one side, the spine is going to twist back. And if the ASIS area tips backwards towards your head, then the spine is going to be flattening.